Okay. So whenever you're ready, Natalie, thank you for doing
Okay,
it,
of
especially.
course. Let's see. Do that way. Present. Oh, why does it not want me to? There we go. Okay. Okay. So today I'm going to talk about it's a type of play therapy. It's called Filial Therapy, and it's been around since about the 60s, and there's a lot of research behind it. And research is even more in favor of this type of therapy than just meeting with the child by themselves. So this is where you incorporate the family into play therapy with the child, and you're basically you're teaching them skills that you would use. Um, so the parents are the change agents, not the therapist. So you're teaching the parents the skills that you would do in play therapy, and then you're doing like observations and helping them grow in those skills. Um, and so the end goal is for the parents to do 30-minute child-centered play therapy sessions at home with their child. And it's a really gradual process for them getting there, but yeah, it's really cool. It can be used with children 3 to 12. You can also do with adolescents, but it does look a little bit different with adolescents. There's an article I've read about that, and we can talk about that if someone's interested in using it with adolescents. Um, and so it says the therapist works with one child and one parent at a time, but I've worked with both parents and then one child. I think if you get more than one child in the room, though, it can be a lot. And so yeah. So it's a blend of a lot of different theories. Most of my favorite theories, it's a blend of. So psychodynamic, these are the big ones: cognitive, behavioral, family systems, and then attachment, developmental. So it's a really cool one. And so what it can help the children do, it enables them to recognize and express their feelings fully. So that's through the play. You'll see that. It gives the children an opportunity to be heard from their parents. They develop problem solving, coping skills, self-esteem is increased, and they learn to trust their parents, get more confidence in their parents, and it can reduce maladaptive behaviors as well. Let's see. Oh, go back. And for parents, it helps them understand their child better. They can watch themes in their child's play, and you can discuss that with the therapist, what that would look like. And it's a huge help in decreasing their feelings of frustration with their child. So right now I have a family I'm doing this with, and I've met with the child for, I want to say since summer, like around June. And this child, his doctor is suspecting he's probably going to have a type 1 bipolar diagnosis. He was adopted from birth, and when they did like the blood test, he had the cocaine in his system. So
Mhm.
mom was on drugs. There's just a lot there. And so his diagnosis is very, very extreme. And so things that we've been working on, they're just not translating to the home setting. And so I've decided to switch gears. And so we're doing filial therapy with the parents, and basically just to help build attachment with the family, because there's a lot of frustration there with his behavior. So this is what we're doing. And this is kind of what it looks like. So it's about 20 sessions. I've never had a parent that has gone up to 20 sessions, just because they usually get it by the time it's like the 10th or below. And they feel confident doing it at home, and they found decreased behavior. So it's a really effective type of therapy. And so these are the skills that I teach parents. So what I'll do, so there's structuring play skill, empathetic listening skill, imaginary play, and limit setting. And these are all skills that you learn if you do child-centered play therapy, but you're just teaching the parent these skills. Um, and I usually, what I do is, and this is what the model suggests, is to have a meeting with the parents just by themselves, and you basically train them to do these skills. And so I do a lot of role playing. Like I'll be playing on the floor with something, like pretend I'm playing with cars, and then I have them practice the skill with me pretending I'm the child. And then we do it like vice versa. I'll be like, okay, you play with this, and then I can show you what I would reflect or what I would say. And I'll go through those skills just to show you kind of what they look like. And this is a very big overview because there's a lot to this model of play therapy, but we can go into depth, like more depth for questions, if whatever you're wanting to know more about. So the first skill I always teach parents is structuring play skill. So this is basically how you're structuring the time together. So I have children go to the bathroom before we even go into the room because we don't want a lot of like going in and out. And so we'll stand at the door and I have parents say, okay, we are going into our playroom. This is our special time we're about to enter in. And so what it does is it switches the child's brain from like, this is normal time with mom and dad to like, oh, this is a special time and there's going to be different rules involved. And so it's always, I have them preface with that. And then the last thing that comes with this skill is just time reminders. So I always have parents do a 5-minute warning and then a 1-minute warning, just like with child-centered play therapy. And so it helps them kind of structure that time. Like, okay, Jimmy, we have 5 more minutes left in the playroom. And it helps the child wind down and know like they're about to clean up. And it helps reduce temper tantrums when they have to clean up because they then know like, okay, I have 5 more minutes, and they're not just quickly like removed from their play. The next one is if you do child-centered play therapy, this is a really common skill. It's reflecting, basically you're not asking any questions. And this is a hard one for parents because they're so used to like, how was your day? What was your favorite thing about school? Like, who'd you play with? And so they're shutting down that skill, and they're going to just be reflecting what the child's doing. So it could be their action. So like, you're playing with the blue car, you picked up the doll, you're putting the doll on the couch. And then also it's reflecting emotions too. So like, man, like when you couldn't get that piece to fit in the puzzle, like that made you so frustrated. So it's reflecting like the process and then what the emotion is. And it is a hard skill for parents to shift to. It takes about 2 times for me to meet with parents for them to get it. Usually what I'll do is I'll meet with them, we'll do training, and then I will observe just the family together and take notes. And this is always the skill that they need the most help with because they're not used to doing it outside of this session. So the next skill is pretty easy. It's just imaginary play. And so basically I like to think of like the child's the director and you're the actor. So if they start entering into this imaginary play, like they're like, I'm going to be the cop and you're going to be the bad guy. You just follow their lead, like they'll play it out. And then if you can ask like, what should I say next? Like you ask the child what you say, and then they kind of play it through. Parents are usually good about this because they're used to their kids doing this at home. And so, yeah, they just follow the lead, let the child play out what they need to play out, and they're just a part of that play. And then the last skill is probably my favorite. It's limit setting, which is part of the reason why parents are coming in and they're needing help is that they may have some poor limit setting at home. And this is a great way to practice doing it in this play space. So this is the template of how I have them word things. So this is how I word it too when I work with kids one-on-one. So let's say like they want to shoot you in the face with a Nerf gun. That's a common one. I would reflect, man, you're upset because you want to shoot me with a Nerf gun, but I would say I am not for shooting at, and then I give them a alternative, but you may shoot the target instead with the Nerf gun. It could be, man, you really want to paint on the table, but the table's not for painting on. You may paint on this paper instead. And so that's the template I have. If the child breaks the limit 3 times, say I give them 3 reminders, I would say, you chose to be done with the painting today. We maybe can try next week, but the painting's over for today. So I give them like 3 3 chances. And then if they break it, I tell them like, you chose to do this. And so it helps them learn like that their actions have consequences. It's a great skill. I have parents, usually I have them set their own limits. I remind them like, no damaging property, make sure that they're safe. But besides that, there's some parents that they like, maybe I'm okay with the Nerf gun being shot around the room. There may be parents that are like, that just feels too chaotic for me. I don't want that. And so they may set their own limit of like, the Nerf gun's not for playing today. Like, but you can throw the snowballs instead or something like that. So yeah, that is the outline. I have it is a very brief outline, and there's a lot to this theory. So we can go into questions, but I also, before we go into questions, I have some books I would like to share with you.
Sure.
So the first one is just this Filial Therapy book, and this is what I had to read for my class to learn about it. And it's a really quick read, and it's really helpful. If you are interested in doing it, I would buy this book to read through. It's going to teach you all the skills, but it's just more in depth. And it's really helpful. And then the next one, if you end up doing it, I would definitely buy this. It's a parent's handbook to Filial Therapy. And what I do is I make copies before going into my training session. So I actually have some prepared right here. So it's like, it goes through like all the skills for parents. And so I print out 2 copies and I give them to parents when we meet together. And so they go through and they can take notes on the side and as they're learning. And it's got like, even like, I don't know, it's got like charts in there. Like I went through a highlight sometimes, like what you should avoid. And then also like the science behind it. Cause sometimes they're like, why are you having us just play with our child? And you're like, no, it's not just that. There's a lot more to it. And this is, plays the child's natural language, and this is how we can help them grow and develop. Another one, so Gary Landreth, he's the guy that is like huge child-centered. He went and developed his own model. So it is still Filial Therapy, but it's just like this is meant for groups. So, but I use it with parents just because I like the stuff that's in it, and I give them the handout. So like, for example, it talks about like, I don't know, it gives you like, parents get a thing that they can fill out, and it gives them like what to remember this week. Like this week, I'm going to focus on the donut and not the hole. So I'm going to focus on my child and not the problem that I'm seeing. And it's really cool. There's even assessments that are in this manual that you can give parents, like there's one that's like, I can't think of the name, but they rate how much they're able to tolerate their child at the moment. And so you could give this to a parent at the beginning of treatment, and then at the end, see like a pre and post. I like assessments because it helps parents buy into it. And so they're kind of seeing like the data, like, oh, this is doing something. And then the last one, if you like more directive types of therapies with parents and children, this one's pretty indirective. Like they're playing and they're, reflecting the process. That's my style. But if I've used this too. So this is called I Love You rituals, and it has like different things that you can set up in the playroom. So for example, I had a child that was very like defiant. And so I had mom come in, and we did this thing where mom kind of directed this game where he would try to we would stack pillows. He took his shoes off, and we'd be like, I bet you can't get to 3 pillows. And he was like, yeah, I can. And so mom would help him. So it was like an attachment building exercise that he was directing, but he was doing it because he thought it was fun, but it was a good way for her to be the boss rather than him. So there's a lot of good ones in there for like power struggle situations, which is a really common one that parents bring their children in for. And I love Filial Therapy because it gives parents a power, like in the situation. Like they come in, they're usually feeling powerless, and they're like, I just want you to meet with my child and fix these things. And instead of like you doing the work and then the child leaving and going home, like you're giving the parents the tools so that they feel like equipped and empowered. And yeah, and the studies show that it's like, I want to say it's got like a pretty high percent chance, I can't remember what it was, but like of parents not needing to come back to therapy. Like it's got more longevity because of the fact that parents are the ones getting the tools. So yeah, sometimes I do both. Sometimes I'll meet with the child and then halfway through I'm like, I feel like we're needing this, like, because it's more of a dynamic thing between the child and the mom. Um, Sometimes you need to do this. Sometimes child therapy is great if there's like a trauma or something involved. So it's just a tool you can use if you're interested with working with kids and parents. And yeah, I really like it.
I like that. So can you do this for me? Can you go through, okay, so um, you get in, so Larry or Megan sets up your thing and you got a kid coming in. Can you run through like, okay, so they put in there, okay, here's what the problem state is, what the issue or whatever that the parent says is what's going on. So can you go through what your steps are from that point all the way through the kind of the first session of what
Yeah,
setting
of course.
expectations with them? And so my thing is, it's getting the expectations from them on what they want out of it too, but it's also what do you expect from the parents, because
Yes,
to me, there should be more expectations on the parents than on you.
absolutely.
You know what I mean?
Yeah.
So anyway,
Yes. And I saw somebody put a question. What I'll do is I'll email Doug the book list and then he can
yeah,
email it out to everybody.
absolutely.
Um, so yeah, so somebody will call in and then Larry will be like, hey, you've got a child that's coming in for like they're hitting their sister or something like that. And so what I'll do is I will have the parents or parent, whoever can come in, I'll say, I just want you guys to come in without the child. And then I will do the intake. I'll get all the information about the child, um, all that. And then that's when I can talk about my expectations. And so I I've never mentioned filial therapy right off front. Usually I see the child like it's probably the most is like or the least amount it's been like 4 sessions until I'm like, this is more of a relational thing that needs to be worked on. And so I at the first session, I always tell the parents, um, you need to be involved in this process for it to work. And I say there may be times where I'm going to bring you in and we can work on some skills. So I kind of preview what filial therapy would look like. Like it may get to a place where, I want you to be in the sessions and I'm going to teach you the skills on how to do this. And most parents love that. Like they love to be a part of the child's therapy. I've had a few parents that like just don't care. Like they're waiting in their car, like drop off their child or like fix them. But that was before I started having I don't learn. I need to set this expectation up front because then you're just stuck with the child and nothing's going to change. And then it's frustrating for everybody. So yeah, I always tell them you need to be involved in this process for it to work. And if you're not able to, I can give you a referral or like I've said that before because I want them to know how important it is for them to be involved in their child's therapy. Because even if I work with the child one-on-one, there's still skills that they need to practice at home and the parents are going to need to know. So
Excellent. Okay, great. Yeah. So right now I want to kind of open it up to everybody. And if if you ask a question, just kind of turn your video on if you could. So I know we should have a lot of questions on this one. And it doesn't have to be about this type of therapy. It could be about anything that to work with children so that we can move forward.
I'll go.
Okay.
So I have a family system and they're going to be new to me and it's 2 kids and 2 parents. How would you do that? Because they want family therapy. And I know there's like some dynamics between the parents, but also with the kiddos. So what would you look like if that was your case coming in? How would you structure those sessions?
yeah, so there's a few things that come to my mind. what you could do is with this theory, you could teach parents the skills and have them practice it. With the children, you could observe the dynamic and then give them feedback of like, maybe they're not very good at limit setting, like they just let the child do whatever. Maybe that's something you could observe. I would, first of all, you can meet with the family, get to know them, and then say, okay, next week, I'm just going to observe you guys playing. And so even if you don't have the playroom, you could bring in the cart. There's stuff there. I've done that before. And then you sit back and you can watch a lot of the family dynamics, or maybe it's like them playing a board game, like who has the most control, who tries to, who's a cheater, like all those things you can watch are from board games, and that's really good information. And then the next session, you could just meet with the parents and be like, these are some things I noticed, like, is this what it's like at home usually? Or like, how did you feel like that went? And you can reflect, and then you could teach the parents a skill based on what you're seeing them needing. So maybe it's like, yeah, I noticed, like, Mom, you're asking a lot of questions, like in this space, maybe I could teach you how to reflect the child's emotions rather than just going to questions or things like that. You could also so there's family play therapy, which is different than filial therapy. There's a lot of different theories in play therapy, so it can be overwhelming. But it's family play therapy, and basically you bring in an activity or something and the family will do it. So based on whatever goals you're trying to work on, maybe it's just like building rapport. So there's one activity is like, there's so many, but one that comes to mind is doing a family crest together. Like you draw out this big crest, and then everybody draws pictures about what makes their family. So like they could draw hiking, like, oh, we love hiking together. That's a good one to start out with because it helps you get to know the family. And then you can also watch for like, how are they able to work together? Did they argue? Like sometimes that's a good test because sometimes families can't even do an activity like that together without fighting or something big happening. So it's a really good assessment to do at the beginning. There's a lot. Linda Lowenstein, I think that's how you say her name. She has a free PDF online that I can also put in when I list the book names. And it is like, I want to say like 100 different activities, and they're all by play therapists or social workers. So they're really good. And there's a lot of family ones in there that you can do as a family that you could have. So
yeah, that would be a great resource. What about addressing like the couples issues? Would you refer out for them to do like marriage therapy separate from what you're doing with the family?
Yeah, I think I would. If you find that there's a lot of problems just between the couple, and it's getting outside of like parenting consultation and training and with the whole family system, if there's things just with that, like dyad, I would be like, yeah, I'm going to refer you to another therapist so you can work on that stuff. But in this room, we're going to work on maybe like the family as a whole. That's what I would personally do, because I think it can get sticky doing everything at once. I like to refer out so it's not as like jumbled, but there's some therapists that would be okay with doing that. And I think that's up to you, but I think I would probably refer them to another therapist to work on that aspect.
That makes sense. Thanks.
Awesome.
Yeah.
So let me ask you this. So what's a basic session look like? So when you come in and you're going to work with both the parents and the child, I mean, do you bring if the child's there, do you bring the parents in, say, hey, this is what I noticed last week? Do you have conferences, or do you call them separately so it doesn't look like you're talking to them behind the kid's back or whatever?
Yeah.
And then, at the end of the session, how do you end sessions too? So I'll give you those two.
Yes. Okay. So it's kind of like a cadence. Like, so 1 week we bring the whole family in, the child. I work with probably one child at a time. And then you're just observing, you take notes, and then you have those ready for next week. Like, okay, this is what I noticed. This is what we can work on. So then the next session is just going to be the parents coming in, or the parent. And then you're gonna like, what did you think? I have like in this book, there's like an evaluation sheet for the parents to write down what they think went well, what they would want to work on, questions they had. And so I usually I send that home with them after the whole family meets. And I'm like, fill this out and we'll talk about this next week. And so then the parents come in, we review everything. This is how it went. And then usually it's like, we need a repeat of this skill. So let's work on this again. And so we'll do some more like role modeling and teaching and practicing. And then the next week, the family will come back in once they got like their questions answered, and I gave them some feedback, and we'll try it again. And so it's about like, I want to say like 5 to 6 times of that. And so they feel more confident and they're able to start practicing at home too. They can film themselves at home, and then you can watch it and like, be like, yeah, okay, this is going good. But yeah, and then ending with the whole families in the room, and we're doing that. I have the parents in charge. So they're the ones that say, we have 5 minutes left. We have 1 minute left. And then after that, it's like, they always say, I have them say, our time in the playroom is over for today. Please pick up and we're going to go to the door. So then usually that's when you notice the power struggle, like, but I was still playing with this. And, then you have them repeat, like you just have them repeat. They're not going to argue because that's typically what they're used to doing at home. And you have them say, our time is over in the play therapy room today. It's time for you to pick up and go. And so they just hold to that and they say it, even if the child's whining. If the child's still resistant, I have them go to the door or go to the lights, turn the lights off, put their hand on the door. And that's usually when the child's like, okay, I need to get out of here because otherwise I'm going to be locked in here. So, so yeah, that's how I and that's a huge part of the work too, is like helping them feel empowered of like, I'm the boss, not my child.
And consistency too, right?
It's a huge part. Inconsistency is a huge part of why this is effective, because the child will learn like, yeah, I can't get around them, like they're not going to bend, and maybe they do at home, but it's a safer place for them to practice like holding on to that like consistency, and eventually it should translate to the home too.
Absolutely. Now, it's kind of funny because I have a puppy and we took him to a dog trainer, right? And so the first thing the dog trainer says, we're going to do these things. We're going to do them consistently. You're going to be the boss, all those things, so you can have a better time with your dog, so that your dog loves you more and that you love your dog more, right? So it's almost just kind of like the children too. So it's like, okay, children know what to expect, and we're going to be consistent in our message every time, so that there's no questions about that. So that's what I like about what you're talking about.
Yeah.
So everybody can enjoy their family a lot.
Yes, exactly. That's why we do what we do, for sure.
Who else has a question?
So what if you have divorced parents? So you've got 4 parents that are involved and the kids are being tossed back and forth week to week. Are you going to bring all 4 parents in?
I don't think I would do that. I don't know. I've never had that situation before. I think in that particular case, I don't think I would do filial therapy, just because it can get pretty messy having all the different family system parts there. What I would do is probably do more child-centered just with the child, and then having parent consultations about what we're noticing, what you can do at home. And that's kind of depending. I've had some divorced couples that are glad to be there together and they're amiable, like they're able to get along. But I've had some where like they can't even like be in the same building together because of things that's happened. So I would just have like 2 different parent meetings. And so, yeah, it just depends on the situation. But yeah, I think filial therapy would be really tricky to do.
So at what age do you discontinue filial therapy? I mean, or would you go opt for a different therapy? Do they age out?
I feel like usually, so this, what with children, I feel like it goes up to 12 with this model. But I feel like you can do it with adolescents. So I did read an article that talked about like ideas you could do for teenagers. And I've never had like, it's not as like structured like I do with this. Like I wouldn't bring the teen in and like watch with the parents. Typically what I do is if I have a teenager that's having a hard time relating to mom or dad, I teach the parents the skills of like, okay, have time, have like 30 minutes where you're not just bombarding them with questions. Do pick an activity they like. So maybe it could be like baking or I don't know. That's the first thing that comes to my mind, whatever they're interested in. And like, okay, you guys are going to bake together and have them lead and you just reflect on like them, what they're doing in that process. And so I teach them the skills, minus the imaginary play skill, because that's not really something that happens with teens. So, but yeah, then the parents can learn like how to interact with their child in a way that hopefully doesn't blow up and lead to arguments or anything like that.
Great question. I think a question I have is, do you, and maybe we talk about, maybe we just make this a whole separate thing. But, you know, when a child does get to a certain age, you know, do you use that same type of therapy, or do you, you know, what's the best ages for each therapy that you use or something like that? You know, we could probably talk about that on a separate.
Yeah. I think just quickly, like, I think up to 12 is typical for like the play therapy type stuff.
Okay.
But I've used it with adults too. So I feel like they can never like really age out. But when I use like more of my child-centered skills, that's really with like kids under 12. And if a child gets to like, say I've worked with them for so long and then they're 12, then I would just kind of switch my gears a little bit and do like, maybe I'm focusing more on like, they're wanting to talk more, so we can switch more into talk therapy, or maybe I just incorporate some like art therapy things too. You just follow the child, and just because they're a certain age, it doesn't mean that they're at that developmental marker. They may be delayed. And so it depends on the person. And so you're just kind of getting a feel. And I always ask when kids are about like 12, I'm like, hey, is this what you're wanting out of therapy? Like, is there anything we've done that you don't like, or is there anything you would want to do? And that gives me feedback of maybe they're like, yeah, like I don't like drawing. I'd rather like maybe if we had more games we could play, that would be better. Or maybe they'd be like, yeah, I actually just don't mind talking. And so that's something you can have a conversation with the child about when they start to get like 12, 13, like that age.
Yeah, I like that because it gives them ownership.
Yeah.
You know, and then, you know, if they've got ownership in it, then maybe they'll take more responsibility for what the session looks like. I like that.
Yes. Yeah. Absolutely. And there are some teens that are so good about that. Like they're the ones that initiated therapy and like they want to talk about their goals, like they love it. And there's some teens that are like couldn't care less like why they're there. But yeah, just depends.
I think, you know, so for me, when it's like the adolescents that could care less if they're there or not, you know, I talked with another student earlier, and so their parents brought the kid in, and then the parent goes, "Do you want to tell them, or do you want me to tell them?" Well, right there, so the kid is viewing this therapy or counseling as a punishment, and then the parent brings the kid in and then does that in front of the counselor. So then it's even, you're bringing the counselor into that punishment too at that point. So how do you set expectations, you know, when you know a kid's not going to want to be there in the first place, you know, at an adolescent, and maybe we talk about this in a couple of weeks or whatever, but how do you get them to understand, the parents to understand that hey, this is their time. This is not a punishment. I don't want to view it as that. We've got to work together to make sure that this is not a punishment.
Yeah, which that is a really common thing that happens, and it's embarrassing and shaming for the child, and of course they wouldn't want to be there.
Yeah.
I would usually, if I notice that, so with teens, I typically the parents with them for the intake. But if I notice a lot of like shaming behaviors or that, then I will tell a parent like, hey, you know what, next week can maybe us two just talk, or maybe if the child's in the waiting room or the teen, like we're just gonna have like a 10-minute discussion. It won't take long. But I just wanted to go over some like informed consent stuff with you. And so they'll be like, yeah, okay. So you'll bring them in, and then however you want to set that up. Maybe you want to do it over a phone call, maybe, you want your own session with them. That's probably how I would do it. It's just like 10 minutes before the child comes in, like we're just going to talk. And then I would probably ask them, like, when they think of counseling, what do they think of? And so then it gives me an idea. Well, it's someone who's going to help my child stop doing all this bad stuff, or, make them behave, or, and then you can kind of reframe it for them. Like, I'm not a magic wand. I can't, just fix them magically. He has to have some buy-in into the process for it to work. And so then that's when I would talk about, and for that to happen, we need to not focus on the problems. We're just going to focus on your child as a whole. And so I would say, I would refrain from saying this, or, saying, when you say this, it comes across as maybe shaming, or, I would try to help them in that way, because they may not see, like, that's probably how their parents handled them. And so they think, they're fed up. They just want someone to fix it. And so
Sure.
telling them that it's part of the process, it's part of the way that their child can get better if you don't do this, or, and tell them a different way to phrase it too. Like, just bring them here and say, this is someone who you can talk to, or you can, that can help you with anything you're wanting, or things like that. That way it's not like the child feels like they're bad, or,
Yeah,
anything.
absolutely. Yeah. So let me ask you this. So during the week, so they come in, they do their session, and during the week, the parents have a lot of questions. How do you handle giving out free advice, free therapy, and all that stuff during the week when it's all meant for that time?
Are you asking like if parents text you a lot, or? Yes. Okay. I've never had this problem, but I have heard it does come up. So what I would do, I'm never gonna just text them a bunch of information unless we had a meeting and I give them like a synopsis of what we went over. That's the only time I do that, like an email. But what I would reply to that is, I would be like, these are great questions, or these are some legit concerns. Why don't we schedule a time where we can meet together and go over this? Or maybe it's referring them to a book if they're not your client and it's a teen. Like, it just depends. Like, if it's a child, I always meet with parents like pretty consistently. And so then that could be a time I'd be like, let's talk about this in our next parent meeting. That's all I would reply to them with. Like, I'm not going to answer their questions, because they're not. Yeah, that's valuable.
Yeah, and the reason why I bring that up is because that's going to happen through you, no matter if the kid, if the kid is young, or you're working with somebody who's an individual, who's an adult, because they're always going to have issues in the moment that are anxiety driven, and they want their answers at that time. But here's the thing. We want to help them and all that stuff too, but what I'm trying to is a kind of a teaching moment for private practice. So when you all have your private practice and everything, is not giving out free information either. If you all have had a lawyer, they bill every 15 minutes. So if they work for 5 minutes, they're billing you for 15, okay? Or whatever it is. So, and I'm not saying you do that with yours, but if you are giving out free advice all the time. Now, you want to help people if there's serious things going on, and you can be a help at that. But if they're just keep continuing asking questions and wanting free advice and all that stuff too, you know, in a business way too, we want to be able to do that during a session, or maybe even schedule another session, even if it's over Zoom or something while they're at home or something. Anyway, that's the business side part I want to throw out for people. Who else has some questions? Okay, so Natalie, what would you give advice on for how to get, what would be the best way to get started with what you just presented today with people? Like how to, you know, is it just reading, you know, reading the material, or what would be the best way for that?
Yeah, I think reading, I would definitely read like the red book I showed, and I'll send that out. It lays it out so easy, like it's a really easy read. And I felt like after I read it before going into my class, I had a really good understanding of it. Like I felt like the instruction, like whenever I was learning, I was like, I already read a book about it. Why are we going over slides again? So I felt like I feel like the book does a really good job of explaining it, and it's a good resource to go to. Yeah, I would read the book, and maybe there may be some YouTube videos. I would watch YouTube videos about child-centered play therapy, so you get an idea of what those skills look like. There's some on YouTube of like, so Gary Landreth is a really good one. That's like his thing. And he's kind of like Mr. Rogers, like he's just really happy. And
Yeah,
yeah.
I've watched a couple of his. Yeah, he is. I thought of Mr. Rogers right off the bat. Yeah.
Yes, he's
It was so cool.
yeah, just so kind. Yeah. So those are good ones to watch. I can link them too.
Yeah, so here's what I've done also. So I've got a page that I'm going to kind of release that we're going to have for Abundant Life Wellness or Counseling Center, right? And so I have I bought the premium part so we can have longer videos too, so we don't have to chop them up and all that stuff too. So if we ever have links that you guys feel are very good for child therapy or any type of therapy, really, send those and I'll put them in our playlist. But for Natalie, if you have some, that you think are just great videos or whatever, send those to me and then I'll put them as part of our YouTube so people can watch those too as well.
Yeah, sounds good.
Yeah. Anybody have any other questions? Ask them now while you got her here. Awesome. Hey, Natalie, thank you so much. Every time you come on, I learn so much. And I just so appreciate your time. You're so good at this. And I appreciate your knowledge and wanting to give that to other people too as well. It's just phenomenal. So, all right. Well, I appreciate everybody getting on. And if you have any questions that come up afterwards, just let me know, and we can get with Natalie and kind of talk through that and kind of get those questions answered. So appreciate all you guys' time, and thanks for getting on.
Thank you, Natalie.
Thanks,
Yeah,
Natalie.
thank you for all you do.
Thank you, guys.
All right, so we have training at 11 o'clock. So just take a little bit of break and we'll get back on. Okay.